So it is my privilege to introduce Dr. James Crooks. He's an associate professor of biostatistics and bioinformatics at National Jewish Health in Denver, Colorado, where he directs the epidemiology and exposure characterization core of the Center for Environment, Climate, and Health. He's also a clinical associate professor of epidemiology at the Colorado School of Public Health, where he teaches environmental data science. His research focuses on understanding the health impacts of climate change and air pollution, with a focus on wildfire smoke and dust storms. He holds a Ph.D. in physics and a Master of Science in Statistics from the University of North Carolina at Chapel Hill. He lives in Denver with his wife, Kristy, 2 teenage sons, 2 dogs, 5 fish, 2 frogs, a very cute snake, and a very ugly tarantula. So welcome, Dr. Crooks.
Hey, y'all. Thank you for inviting me. I really appreciate the opportunity to speak to you. This is actually my first day in Montana. So thank you. This is fantastic. I love adding a new state to the list here. I'm going to talk to you about health impact of air pollution, particularly particulate pollution and wildfire smoke. We've heard a little bit about that in some of the previous talks. I'm going to dig into it a little bit more in this one. So I have no disclosures. The learning objectives are to describe the connections between climate change and wildfires in the Western US, explain how wildfire smoke affects patient health across the life course, and identify which specific patient groups are at greatest risk from wildfire smoke-related adverse health outcomes. So I want to pause for a second. Close your eyes. Take a deep breath. I want you to think for maybe just 10, 15 seconds about what matters to you. What brings you into this room? You're in this room because you care about something. You care about something very deeply. I want you to just think about it for a few seconds. I'm going to tell you what I care about, what matters to me, what brings me here. And it's these folks. This is my family, my 2 sons, Joey and Charlie, my wife, Kristy. The reason I'm here talking to you today is because I have become more aware over my life about the impact that climate change is having and will have, particularly on my children. You know, if they have a normal lifespan for someone born when they were born, they will be alive into the 2080s, long after I'm gone. That means I am heavily invested in the success of our world into at least the 2080s. Now, the path that brought me here was pretty long and windy. But if I have to pick out one moment of, just like, oh, wow, okay, this is a thing that we need to be dealing with, and I need to make part of my professional life. It was a moment in August of 2005 when my older son, Joey, was 4 months old, sitting on my lap. I'm watching the news, and I'm watching news reports from New Orleans in the aftermath of Hurricane Katrina. And I'm seeing other parents holding other babies who are about the same age, who are suffering from heat stroke and dehydration while waiting to be rescued, who are at the Superdome for days waiting for buses that don't come. And all of them were Black. And this is when it hit me. A number of things hit me. First of all, climate change is not a thing that will happen. It is a thing that is happening right now. And second, that our response to it is woefully inadequate and extremely racist. So that's what sort of started me on this path to my current career. My path has shifted a little bit, so I am now, I focus on air quality issues. That's mostly what I'm going to be talking to you about today. So I'm going to start off talking about sort of some more climate change primers. We've seen some of that in the previous talks, but hopefully this will reinforce some of it. Also going to talk about sort of general air pollution issues, and then finish off with the air pollution issue that probably affects your lives the most, which is wildfires. So, quick climate change primer. Now, let me just back up and say I had 1 hour of climate change education in primary and secondary school, and that was a lot for my generation. Many of us who are older had none. And so some of the younger folks, this may be a review. If you're older, maybe it's not. But I think it's worth just reminding ourselves, what is the scale of the issue that we are grappling with? So this plot that Dr. Patel actually had on her slide 2 shows the concentration of CO2 in the atmosphere over the last 800,000 years, ending at the beginning of the 19th century, at the beginning of the Industrial Revolution. And just to give you a sense of scale, where that x-axis says 300, that is when anatomically modern humans evolved. So we are relatively young on the scale of this plot. In addition, the entire toolkit that we associate with civilization all developed toward the end of that figure in the last maybe 11,000 years or 12,000 years. Now, over this 800,000 years, global CO2 levels have varied between a low of about 180 parts per million and maybe 280 parts per million. All of that toolkit of human civilization, farming, writing, cities, developed, and actually the very end, when the global CO2 was pretty high in that range, so between maybe 260 and 280. So, you know, the reason that agriculture developed where it did was because the climate allowed it in those places. Now, when the CO2 level was sort of at one of the maximum values, that's when the climate was kind of like the one that we grew up in. When the CO2 level was at a trough down around 180, that was a very different world. That was an ice age. That's literally, this is a trace of ice ages, okay? And I don't just mean it was kind of cold. I mean, it was so cold for so long that there was literally a half-mile thick ice sheet on top of Seattle, on top of Minneapolis, on top of New York City, on top of the northern half of Montana. So you can imagine walking around outside and just think, half-mile thick ice sheet on top of me. That's a radically different world to allow that to happen. And that's because of the global CO2 level. Now, in the past 200 years, human activities have added another 100, actually by now 135, 140 parts per million on top of that. That's a lot, and it's a lot very fast, right? I mean, 100 was enough to melt a mile thick ice sheet on top of New York. The overall consequence of that was that global temperature on average increased by a little over 1.1 degrees Celsius in the last 200 years. So it's just shy of 2 degrees Fahrenheit. Now you may be thinking like, well, if going from 180 to 280 was enough to melt a half-mile thick ice sheet, why haven't we seen a bigger change in the past 200 years? The reason is because there's a lot of kind of inertia in the climate system. Just like when you get in bed and put your blanket over you, you're not instantly warm. It takes a while to, you know, for that heat to get trapped. Same thing is happening with CO2. It takes a while for that CO2 to trap all the heat it is capable of trapping. So that's a good thing and a bad thing. It's a good thing because we haven't baked ourselves yet, right? It's a bad thing because even if we stopped emitting CO2 today, climate would still warm some, right? Of course, we're not going to do that. We're going to keep emitting. And the more we do, the hotter it's going to get. Now, to get a sense of like what that actually means in terms of realistic scenarios, I think it's useful to go back about 10 years to the previous IPCC report and the different emission scenarios that they were envisioning back about 10 years ago, low emissions to high emissions. So on this graph, if we think about the low emission scenario that was envisioned 20 years or 10 years ago, that envisioned global CO2 levels stabilizing at 420 parts per million in the year 2100. We're already hitting 420 certain times of the year. So that goal is off the table now. The other scenarios, there are a couple of moderate emission scenarios where there was some climate mitigation. There's one where we end up stabilized at 540 parts per million at the end of the century. And another where we end up with 625 and still increasing in the year 625, or by the year 2100 at the value of 625. And then the burn everything in the ground, business as usual case circa 2010, we end up with 930 parts per million CO2 in the year 2100 and still increasing. My personal view on this is that There is no conceivable way human civilization survives that scenario. It just doesn't. There's no way to feed 11 billion people in that world. It is too radically changed too fast. Fortunately, that's not the trajectory we're actually on, it seems like. Certainly starting in the late 2010s, we started to kind of fall off that business as usual case. And I don't have a data point for 2021 or 2022, but emissions have roughly stabilized over the past several years. 2020, there was a dip and then it came back up. That's not good enough. We need it to go down fast, but it's a whole lot better than being on that red line, right? So where we end up, we don't know. Climate change is a choice. It is a choice we as a society have decided to make, and we can make other choices. And depending on what we decide, we're going to end up somewhere on that scale. Now, these four scenarios also map onto temperature. It's not just about emissions. The CO2 level defines what temperature we're going to have. So that high emission scenario, we would end up with global surface temperature on average about 4 degrees Celsius or maybe 7 degrees Fahrenheit above late 20th century average. That's a lot. Now, we're probably not going to hit that. We're probably going to be somewhere more like 2.5 to 3 right now with current policies. We need to drive that down as close to 2 or 1.5 as we can. But 2.5 is a lot better than 3 or 4. But the thing to remember is even if 2.5 degrees doesn't sound like that much, first of all, it's like 4.5 degrees Fahrenheit. And second of all, the poles warm faster than the equator and the land warms faster than the ocean. So places like here that are pretty close to the pole and pretty far from the ocean are going to warm a lot faster. So we're talking 50 or 100% faster than global average. We could easily get to 9 degrees warmer here. And you can imagine what kind of impacts that might have. Drought, on stress on the forests, and that leads to things like wildfires. All right, so now I'm going to pivot and talk about air pollution because particulate air pollution is deeply involved in climate. It is co-emitted by processes that also emit carbon, and it is also a function of climate change, warming and drying out forests and causing fires. Right? So particulate matter. We've been talking a lot about it today. I think it's good to go a little bit more into the background. There are several sources for particulates. There are processes that directly emit particulates into the air. Things like burning coal and oil, vehicle brake and tire wear, exhaust from diesel engines, along with natural sources like wildfires, dust storms, sea salt. There are also processes that burn and emit gases that then condense into solid or liquid phase particles downwind. So whenever you hear someone talk about like clean burning natural gas, what that means is it doesn't directly emit particles. It's not actually clean at all. It emits lots of other stuff. And some of that other stuff condenses into particles later on. It's just not emitting soot directly. So things like fertilizer fumes, vehicle and power plant exhaust, leaks from oil and gas development. All those can contain ammonia, nitrogen oxides, sulfur oxides that can condense into particles later on and cause particle pollution. So not only are the gases themselves often harmful, they can transform into particles that are also harmful in a different way. When we talk about particles and their health effects, we tend to talk about these numbers. And I think it's good just to make sure everyone knows what those numbers mean. Probably most of you do, but in case you don't, when you have a little number after PM, that refers to the size bin. So PM10 is talking about particles up to 10 microns in size. So anything smaller than 10 microns. PM2.5 is up to 2.5 microns. That's also often called fine particles or fine particulate matter. And then we have these other size bins. There's one in between 2.5 and 10 microns. That's like dust. And then ultrafines or nanoparticles, which don't have a strict definition, but something like a tenth of a micron across or smaller. And these are really, really tiny. And the reason we talk about the size is because the size is, there are sort of historical reasons for using those particular size cutoffs that have to do with the monitoring technology over time, and then also the sort of health effects we were able to identify over time. So when we were able to monitor PM10, we were able to find links between PM10 and respiratory diseases. So exacerbations of COPD, asthma, emphysema, as well as kind of the trajectory of lung cancer in analogy to smoking. And then a funny thing happened in the 1990s. As our monitoring technology got better and we started understanding health effects better, we started finding links between the smaller particles, these fine particles, 2.5, PM2.5, and cardiovascular endpoints, strokes, heart attacks, congestive heart failure. And that's unintuitive, right? When you go outside and the air pollution is clearly bad, your lungs may feel tight, your kid may have an asthma attack. The link to respiratory health is very obvious. When you go outside and the air quality is bad, and then 2 days later you have a heart attack, you're probably not going to make that connection. And yet we know that connection is there. And it's even more important than the connection with respiratory health on average over the whole population. And we know why. We have a very good understanding of the mechanisms of this. So there is the fact that smaller particles can get deeper into the lung where you can't cough them up or sneeze them up. They get stuck there. Your immune system has to fight them off. There's an inflammatory reaction. That inflammatory reaction doesn't just stay right around the particle, it spreads out to the rest of your body. You have an increase in systemic inflammation over time, which can lead to cardiovascular harm. Plus, if the particle is really small and may not get stuck in the lung, it may go all the way through the alveoli into your bloodstream and get pretty much anywhere in your body and land and cause some kind of problem there. And I do mean like anywhere. The smaller particles can get through basically any biological barrier you have in your body. In fact, we can find diesel nanoparticles. They're easier to find because they're so metal bearing. We can find them in the brain. So we know that they can pass through the blood-brain barrier. We can find them in human placentas. And just in the past few months, we found them in fetal remains. So we know they can pass through the placental barrier. We can find them in human kidneys and basically any other tissue we look for. They are there. Now, particularly the human placenta and the fetal remains, that's telling us that babies are exposed in the womb before they're even breathing on their own. That should infuriate you. That's horrible, right? People are born already behind, some people, They're born already being affected by this. And it's not their fault. It's probably not their parents' fault, There is an intrinsic justice aspect to this that is just unconscionable. So, as we've learned about these particles getting all over the body, it's caused kind of an explosion of our knowledge about the health effects of particle pollution. Over the past 20 years, we found links between particle pollution and congenital birth defects, low birth weight and preterm birth babies, developmental delays and behavioral problems in childhood, autism, dementia, Alzheimer's, and Parkinson's diseases, cognitive declines, metabolic syndrome, diabetes, and obesity, and the list keeps growing every year. Some of these have more evidence for them than others, but over time, there's a stronger and stronger case showing very broad health impacts. And just to give you a sense of how broadly we're thinking, I want to show you this one paper that came out in 2019 that just was like, okay, if we look at the Medicare cohort and look at hospitalizations and how they relate to particulate matter by the sort of underlying cause of the hospitalization, they can find links between particle pollution and things you would never think to study. Things like septicemia, fluid and electrolyte disorders, and acute and unspecified renal failure. 10 years ago, no one would have thought to even look at that, right? But nowadays, it's like, oh, okay, well, we're seeing health effects in basically every organ system. And this causes, as you might imagine, an enormous burden globally and in the United States. So globally, if you look at risk factors for mortality, air pollution is the #4 risk factor pre-COVID. So 12% of all global mortality, that's like 7 million people a year, are killed by air pollution. That's an enormous number. I mean, it's twice as many killed by malnutrition. I bet nobody in this room would have guessed that. And if you look at specific causes of death and how much of each cause of death are attributable to air pollution, 40% of COPD. That's not from smoking or not primary smoking. That's air pollution from other sources, indoor and outdoor. That's stunning. I mean, normally we associate COPD with smoking, right? It's not all smoking. We also get 20% of diabetes, a thing you probably wouldn't intuitively connect to air pollution at all. 20% of neonatal deaths. Again, most people are not going to connect those to air pollution. So that's globally. What about the US? Well, there's this paper that came out 2021 looking at mortality globally, but also in the US. I'm going to focus on the US part. From particulate matter just due to fossil fuel burning, not from other sources, just fossil fuel burning. And they took 2012 as their index year. They found in the US, fossil fuel burning was responsible for 355,000 deaths in 2012, 12% of overall mortality in the US. Just to give you a sense of scale, that is the number of people who were killed by COVID in its first 9 months in the United States. It's a huge number of people. 9 times the number of Americans who die in traffic accidents each year, 3 times the total number of US service members killed in all wars since the end of 1945. It's an enormous number. And if this isn't a crisis, I don't know what the word crisis means. And yet we see right through it. We just accepted it as normal. You know, it looks to us like normal aging. It's not. All right. Now I'm going to talk about wildfires. Obviously, there's a lot of overlap between our knowledge about particulate pollution and wildfires because wildfires contain particles. I think it's important to know, there was a question earlier about the relative toxicity of wildfire smoke particles versus other kinds of particles. So I'm going to explain that. So wildfire smoke doesn't just contain the particles, it also contains all these other things that have other health effects. So carbon monoxide and nitrogen oxides affect your lungs. Polycyclic aromatic hydrocarbons are cancer causing. Volatile organic compounds, some of them are cancer causing, some of them cause neurological problems. So the overall sort of weight of impact of wildfire smoke is going to be bigger than just PM 2.5 itself, just because there's so much else in the smoke. And so when we're doing a health study on wildfire smoke, we're normally attributing the overall health impact to the PM 2.5 because that's what we're measuring. But we're essentially using PM 2.5 as a tracer for this whole mixture that contains a bunch of other stuff. So some of the higher toxicity for PM 2.5 is just due to the fact that there's all this other stuff we aren't measuring that's coming along with it, but we're seeing the health outcome from. But there is also evidence that the particles themselves are worse for you than other kinds of particles. Particularly smoke that has been in the air for a while. Because a really big wildfire can inject a huge amount of particle pollution very high in the atmosphere, where it undergoes chemical reactions as it's floating through the air downwind for several days. And those chemical reactions increase the oxidative state of the particles. So when you breathe them, it causes more oxidative stress than a fresh particle, or maybe particles from other sources would. So in that sense, yes, the particles themselves on a per mass basis may actually be more dangerous for you when they are smoke, particularly older smoke. Now, if you're closer to the fire, that doesn't mean you're safe. You're probably getting a much higher exposure overall, like you're getting a higher dose, even if the unit dose is not as toxic. And of course, we're getting more fires. The number of acres burned per year in the US is roughly tripled since the late 80s. Doesn't show any signs of going back down. The only scenarios for the future where the number of acres burned goes down is where it goes up so much at first that we burn through most of the forest in the Western US. So we don't want that to happen. And even as we've, through the Clean Air Act and EPA actions, we've managed to bring down other sources of particulate matter. A lot of that progress is being negated by the wildfire smoke increasing. So this figure on the right is sort of the Colorado population average smoke exposure and non-smoke PM exposure from 2006 to 2021. So even as overall non-smoke PM has gone down, the smoke contribution has gone up and almost canceled it out. And if you look from the years 1980 to 2016, what that trend is in overall particulate matter exposure, most of the country it's gone down because the Clean Air Act is doing its magic. The only place it's not going down or didn't go down over that time was right here, because smoke has gotten so much worse. It's more than counteracted the benefits of reducing emissions from other sources. And we can attribute a lot of this increase in the smoke and wildfires generally to climate change. Not all of it. Some of it's due to people moving to more fire-prone areas and accidentally or intentionally setting fires, things like that. But more than half of it is actually due to climate change. And study after study sort of confirms this. So somewhere between half and 2/3 of the increase we've seen is directly attributable to the warming and drying of the western forests. What that means is the number of very large wildfires has gone up as the climate has dried and warmed. The length of fire season has increased. And as an earlier speaker mentioned, we've sort of lost the sense of what a fire season actually means in some parts of the country, because it's just all the time. I mean, there was a massive fire that tore through 1,000 homes in suburban Denver on December 30th of 2021, displacing thousands of people because it hadn't rained in 7 months. You know, this is not a sort of late summer, early fall kind of a thing. This is most times a year kind of a thing now. And the predictions for the future are that this becomes more of a problem. Now, this is under that high emission scenario that we're not in anymore, thankfully. But under that high emission scenario, a place like Eastern Montana would have 6 times the number of weeks per year at high wildfire risk compared to the late 20th century. Now, because we're not on that trajectory anymore, that number is not going to be 6 times as much, but could easily be 3 or 4. That's a big change. And we know wildfire smoke affects our health a lot in many different ways, just like particle pollution. You know, we have 40 years of evidence for that. Wildfire smoke, it's a newer object of study from a health perspective. So we've only been studying it maybe 10, 15 years. So the number of results is smaller, but it is growing, and we're very certain of some of these results. We're very certain of effects on respiratory health, asthma, emphysema. We're pretty certain of its effects on cardiovascular health through all the mechanisms I was describing earlier. We know cardiac arrest. You know, we can study this in vitro assays, in vivo assays, and model animals. We can study it in population studies and clinical studies, and we're getting pretty consistent results for respiratory and cardiovascular disease. We can study pregnancy outcomes. We have evidence of increased risk of preterm birth and low birth weight based on wildfire exposure. There's even a little evidence, not conclusive yet, for maternal endpoints like risk of gestational diabetes and hypertension. We can see impacts on just overall ICU admissions. And so I did a little modeling study where I looked at if we had a really severe fire smoke wave like the Bay Area had a couple of years ago, where you have like 200 micrograms per cubic meter for a week, what happens to overall ICU admissions? And we were predicting a roughly doubling of maximum ICU bed use during the weeks to follow. That means, you know, ICUs are already stressed for so many other reasons. And, you know, there isn't usually a lot of like free bed space because that's wasteful when there's not a pandemic. So we need to be aware that like we may need to pre-position resources if we know a fire or smoke wave is coming. We can also find links to cognitive function. There's this great little study that came out, I think earlier this year, maybe late last year, looking at a smartphone game. And because it's on a smartphone, you can figure out where that smartphone is located. You know what time of day, or you know what time and what day they're playing the game. And you can link the scores that people get on their games to the air pollution level. And you can find that the more wildfire smoke there is, the worse people do on the game. And this is just one study. I mean, I'm showing you a tip of a very large iceberg of research from this area. And of course, not everyone's going to be impacted the same. Just like with any harm, there's going to be inequities. There are going to be certain groups that have kind of more vulnerability, more susceptibility. So individuals with pre-existing disease could be tipped over into an exacerbation or into some acute event by the air pollution exposure. Children, older adults who are already sort of sensitive, have some sensitive lungs, could be tipped over in some kind of acute event based on wildfire smoke exposure. People who work outside are going to have just a very high exposure level, which can lead acutely or over time to endpoints. People who live outside because they're unhoused, same thing. And people living in older housing stock may have a home, but it's very drafty. Like there's a lot of air infiltration. They have a difficult time mitigating their exposure even in their own house. But what can people do? What can your patients do to protect themselves? I know you probably have heard a lot of these ideas before. There's nothing magical about them. I'm sure your public health agencies have been trying to tell people to use these ideas for the past several years, but it's just good to reinforce them. First of all, if you can stay inside, it's probably better to stay inside when it's very smoky. If you have to go outside, you can try to wear a mask. It is incumbent to use a pretty tight fitting N95. Anything less will probably not work very well. You know, the cloth masks most people have because of COVID, they're good for stopping spread of COVID. They're very bad at preventing exposure to PM. So they're not really good enough. And of course, N95s are uncomfortable and people don't like using them, particularly if they're exerting themselves outside, but it can help. For individuals with a central HVAC system, encourage them to change the air filter regularly and run the HVAC fan more often on smoky days. That can help push the air through the filter and clean the air inside the home. For individuals without central AC or who live in an apartment and can't control the filter situation, they can purchase or build an indoor air filter of their own. I will strongly suggest that it does not have to be fancy or expensive. The only thing you want to look at is what is the size of the space they're trying to clean the air from, and that's it. You don't need a bunch of other bells and whistles. Filter companies love to upsell you on a bunch of stuff that's probably not that useful, make it very expensive. You don't need an expensive one. You know, we saw a picture earlier of a box fan with a filter just taped to it, totally fine. If you want to go out and buy a special purpose one, you can. You don't need an ionizer. You definitely don't want something that adds ozone to your house. Why would you make your house more polluted? That doesn't make any sense. The only reason you'd ever want that is if the risk is infectious disease spread through the air in your house. But on a smoky day, probably the main risk is not that. Probably the main risk is the particle pollution. You definitely don't want to add ozone. You can also try to encourage people to tighten their building envelopes if they own the house or they own the structure. You know, tighten the windows, tighten the door, you know, the gaps around the door frame. That can prevent more air infiltration into the house. So you don't need as much interior filtration. Encourage people not to burn things in their house. Like, you know, we hear stories about, oh, well, it smells like wood smoke because the smoke coming in the house, so I'm going to burn candles or incense. Oh, please don't do that. Please discourage people from doing that. Why would you actually add more air pollution to your house? Even if it smells better, it's definitely making you less healthy. You know, filtration is much, much better. Now, none of these are a perfect solution. There is no, you know, wave a magic wand and make people perfectly protected against smoke. You just can't. But all these can help some. And for some people, you know, some help can be the difference between saving their life and not saving their life. All right, so I'm going to leave you with two parting thoughts before we go, or before I guess we have questions. First parting thought, because the impact of particularly particulate matter air pollution is so huge and so much of it is linked to fossil fuel burning, we can actually justify immediate and drastic reductions in fossil fuel use, not on the basis of future climate impacts, but on the basis of how it would improve our health now, right? We're talking 300,000, 400,000 people a year whose lives could be extended. It's hard to find another public health intervention that could do that, right? Childhood vaccines, you know. But other than that, it's hard to think of something that is that impactful. We don't have to argue about the social cost of carbon and discount rates and all this kind of wonky stuff. You know, it's fine to argue about that. That's all important. But even without that, if we just ignore the social cost of carbon, we can still justify massive climate action in a dollars and cents sense, entirely on the basis of health improvements in the near future. right? We don't have to think about like, what benefit is somebody living 100 years from now going to accrue based on my action today? We can think about what benefit is someone going to accrue tomorrow based on my action today, because that benefit is enormous. Now, the second thought is, that doesn't mean we shouldn't think about 100 years from today or 80 years from today. If you look at the life expectancy at birth in the United States right now, it's about 78 years. That's going to be the 22nd century. I mean, I'm 47 years old. I remember when the 21st century sounded like science fiction, right? The distant future. And yet here we are. You know, I'll be lucky to still be alive in 2050. So I have to remind myself, like, the people around me are going to be alive a lot longer. So the reason I mentioned earlier that my children are going to be alive in the 2080s probably is to remind myself, my children will still be alive in the 2080s. There are people in this room who will still be alive in the 2080s. There are people you know, the people you may go home to, the people you treat, who will be alive in the 22nd century. So we are here today for them to make sure that the next 80 years gives them a good chance, right? So we get so tied up in like, you know, the news cycle and the election cycle and the business cycle and like your uncle saying stupid stuff on Facebook. We need to like lift our eyes up and just remember what the long term is here, because for a lot of us are going to be here for a long time. A lot of people we know and care about are going to be here for a long time. And I think it's incumbent on those of us who are older to remember that. So thank you very much. We have time for questions. Is there time for a question? Question? The question is about firefighters and how they can be protected. Yeah, there's actually a fair amount of research on exposure and protection for specifically wildland firefighters. I'm not super up to date on that. I think it's probably impossible to avoid some impact on them, but, you know, encouraging protective measures like mask wearing and stuff like that can help. Yes?
I have a question kind of also about that. Prescribed fires, right, are supposed to, you know, reduce wildfires.
Yeah.
And they're good fire, but they still create smoke. So how do they mitigate that risk? Okay,
so the question is about prescribed fires and how you can do prescribed fires safely in a way that mitigates like air pollution risk. Obviously, you want to mitigate the risk that they get out of control. But basically, the wildfire using prescribed fires, you generally want to do it like in the early spring when the trees are usually like just out of snow cover and things like that. So, but they're dry enough that they don't create a lot of smoke, but they're not so dry that like the fire gets out of control. And so there's an art to doing that. And sometimes fire managers get it wrong and you get a fire that burns out of control. But they definitely are aware that that is an issue and try to mitigate it as much as they can. The EPA actually allows states to exempt smoky days of certain kinds from their air quality compliance calculations. There's a lot of debate about whether that's appropriate or not. You know, you don't want to disincentivize people from doing prescribed fires because fire is a natural part of the landscape. And this choice is not between fire and no fire, it's between small fire and gigantic fire. You'd much rather have small fire under control, right? But on the other hand, you know, there are impacts from that prescribed fires that, you know, some of them can be dangerous to people sometimes. There's not like an easy answer to it.
What about prescribed and the, I don't know, is that being adjustable? Like, say in Colorado, is there a common practice and this year around London, where I live, I'll accidentally find myself driving the back road and then getting caught in a really big burn where I would be like 30 fires, you know, trying to get through it.
I wouldn't say in Colorado it's a major practice just because we are so fire prone. I have never seen anyone setting an agricultural fire. That said, places like Florida do it all the time for sugarcane, and there are plenty of other places around the world where that is a common practice for sort of getting rid of some of the foliage after harvesting. You know, those are bad for health, particularly the workers who are around the fires, setting the fires, the communities that are immediately downwind of the fires. You know, there are major impacts from it.
When you were talking about older smoke being worse, I was thinking like Missoula, where we get this heavy inversion, the fires aren't even in us, but we're getting smoke from Idaho, California. Are you saying that smoke is even more deadly or dangerous?
Well, so on a like per unit mass basis, older smoke tends to have a higher oxidative state and thus cause more oxidative stress. If you are closer to the fire, you are getting a higher mass dose, right? So there's this balance where if you're kind of too close, you're getting an enormous dose, but if you're further away, you're getting a smaller dose, but that dose may actually be per unit mass more toxic. So it's a tricky thing to communicate, as you've just discovered. Yes, ma'am. That's you, yeah, in the red.
In hospitals,
Mhm.
we actually have a challenge keeping the air clean during really heavy days. That's with 20 air changes an hour in our procedural areas with really good filtration. To the point that we're needing to understand when should we stop? You know, when should we not do surgery and for which patients? When should we not do other procedures? And to my knowledge, we've done a little bit of looking at it. It hasn't been well studied or reported. I wondered if you knew something about that or had some resources for that. We have an intuitive sense, you know, if people are older, fragile, with COPD or heart disease, but we'd like to have a little more science.
Okay, and so the question is about hospital ORs. Is there a point where the smoke outside is so bad and some of it is just leaking in because it always a little bit leaks in? Is there a point where you should call off operations because of it? I don't know anything about that, actually. That is a great question, though. I think it is important to be measuring your indoor air quality and sort of relating that back to EPA standards or occupational health standards. But those are not developed for people going into surgery who might have a lot of comorbidities. So you may want to be a lot more conservative in terms of like, well, okay, maybe we postpone this particular surgery for a week and see how things turn out. I don't, you know, as far as I know, there's not good guidance. I feel like the medical establishment as a whole, like the medical societies that give guidance about stuff like that, or about like exercising outside, you get very different takes or no take at all, depending on which society you're talking to. And it's, to me, like very frustrating that like, if you talk to pulmonologists versus, you know, heart doctors, you get very different sets of recommendations about what is safe outside behavior and things like that. So I would love for them to have, you know, produce guidance about that specific question. Yes, sir.
Two questions. One is, you mentioned that with PM2.5, there's a decline in cognitive function both short and long term. In Montana, over the past decade or two, we've seen worsening forest fires, worsening PM2.5. Also, during that time, we've seen increasing stupid stuff coming into the legislature. Second question is, the Clean Air Act was incredibly successful in a lot of areas and is supposed to regulate PM 2.5. Why is the Clean Air Act ineffective in this space?
Okay, so the question is about the Clean Air Act, and it's been so effective in many areas, and why is it ineffective around wildfires? Is that what you're asking? So that was actually a choice that I think the H.W. Bush administration made. I'm not sure. One of the administrations produced guidance about what states can exempt from their compliance calculations, and said wildfires don't have to be counted. Like wildfire days, you can just pretend they don't exist when you're calculating the average to compare to the standard. Again, that's controversial. As far as I know, no subsequent administration tried to overturn that because, again, you don't want to disincentivize prescribed burns. And, you know, the Clean Air Act was designed with sort of human-made pollution as its target, not with natural pollution. And it didn't really conceive of a world where the natural pollution like wildfires could have strong indirect human influence, right? It's just not part of its frame of reference. We now live in a world where that is the case, though. So there are a lot of ways that there are gaps in the Clean Air Act that I really wish could be filled. That is definitely one of them. We also need to be regulating pollution at a more local level to make sure that environmental justice communities and communities that have been, disproportionately impacted are protected, because right now a lot of them aren't. We need to be looking at a lot more at air pollution from oil and gas development and like the VOC emissions and stuff that are right now regulated at the emission source, but not regulated in the surrounding community for some reason. That is a gap. So yeah, the Clean Air Act is not perfect. It does a great job at what it was designed to do, but we have a different set of needs now. So it'd be great to add to it. Oh, sorry, you're way over there.
Yeah, we're seeing that there are different societies recommend different standards in terms of activity, and I'm curious, do you have a favorite set of standards and a favorite site where you would look at air quality?
So what I'm thinking specifically of is recommendations about kind of outdoor activity during high pollution days, specifically wildfires, but pollution days of any kind. If you ask the cardiovascular disease doctors, their recommendations are generally like exercise. If you're going outside, exercise is so great for you that it kind of doesn't matter how polluted the air is. Whereas you talk to the pulmonologist and they're like, well, it does. But they're not talking about exercise. They're just more like talking about going outside. Neurologists who really have, a dog in this fight too, you hear nothing, like there's nothing. The OB-GYNs, as far as I know, there's very little. Maybe there's some and I just haven't seen it, but I would just love it if the medical societies could just like get together in a room for like a couple of days and just hash this out, that'd be amazing. Is there any online questions? We good? All right, thanks y'all.